Phone and text lines are currently closed.
Anneliese of the Health Hub Times Square in Ballincollig joining us on this Monday afternoon. Good afternoon to you, Anneliese.
Good afternoon.
And you're very welcome. Lots of questions in for you. I'm going to put two questions in together because they are similar. Kathleen was on looking for any supplements that will help reduce blood pressure, and another listener is on as well, any natural remedy to reduce blood pressure. This other listener is on a tablet at the moment but she hates taking meds and would prefer a more natural route, lowering blood pressure.
Okay, well, the first thing I would say, Patricia, is that actually elevated blood pressure is dangerous. It's not like cholesterol, which takes time to cause problems for the heart, but blood pressure, high blood pressure uncontrolled, is dangerous. And there are natural supplements that can help, but realistically speaking, they're not going to be as effective and they're not going to be as dependable as taking a medication. So I think that it's not good to come off medication and try and manage your blood pressure naturally. If you wanted to think about giving up tablets, you could take some natural stuff alongside your medication and then make sure that you're measuring your blood pressure on a regular basis. And if you notice it's dropping, then you can certainly talk to your doctor about reducing it. But you don't want to have uncontrolled blood pressure. Patricia, puts a huge strain on the heart. And that, if the heart muscle becomes enlarged and damaged over time, that's not something that can be fixed either. So the natural remedies typically would be, the first thing I would definitely recommend anyway is a fish oil. And the reason I recommend that is because, for blood pressure, is because it thins the blood. So if your blood is nice and thin, it'll flow beautifully through your veins. And also, it can help your veins and arteries be more flexible in a roundabout way. So it's going to do those two jobs. Plus, it's all the lovely natural anti-inflammatory properties that it has as well. So I would definitely take a fish oil, and you're looking for at least, you're probably looking for about 500 milligrams of EPA and at least 250 milligrams of DHA. They're the different types of omega-3 that you get in the oils. So the brand that we love here is the Unocardio, and you also get your vitamin D with that as well, so it covers you for that. The other typical things for blood pressure would be hawthorn, which is a herb that is very tonifying for all of the vascular tissue, so your veins, your arteries, your capillaries. It's great for diabetes as well because it keeps those tiny little capillaries that go out to fingers and toes very healthy. It's another one I'd recommend for people with Raynaud's as well. So hawthorn is excellent. Magnesium can help hugely as well because in terms of relaxing muscles and arteries. And coenzyme Q10 is another one that can help. And Terra Nova actually have a blood pressure product with all of those in there. And it is called, I think, magnesium hawthorn and coenzyme Q10. And then there is another product that's Vogel do with just hawthorn in there with garlic, and garlic has the blood thinning effect of that. So you could try those, but make sure you're monitoring your blood pressure and that it's not, that it's coming down. And don't think about giving your medication up lightly because there are side effects to that.
Okay, question for Anneliese, please. Over the last 2 months or so, I have been on very strong painkillers. I can see from a previous text the sister had an injury. So they were on strong painkillers and anti-inflammatories. Off them all now, thankfully, but I'm finding my stomach is still quite upset from all of the medication. I took some Biocult that I had at home and it did help. But I find now I'm back to square one. I'm wondering, do I start again, and how long should I take it for, and how long should I stay on it to settle my stomach? And your stomach does get upset by a lot of painkillers, wouldn't it, and anti-inflammatories?
Absolutely. Well, there's the anti-inflammatories, particularly the non-steroidal anti-inflammatories, are very damaging, and there's lots of clinical evidence for that. They do cause inflammation in the gut, in the stomach lining particularly, so everything is probably feeling a bit raw. There's a couple of different things that can help here. Biocult definitely would help because that'll help put the good bacteria in further down, but it's not really going to do anything for the healing of that inflamed and damaged tissue in the gut. So the best things to take for that would be things like L-glutamine is one natural remedy, marshmallow and gamma oryzanol. These are all really, really good. If you feel it particularly in your stomach, the best thing for that is probably mastic gum. So in terms of supplements, there is a great one made by a company called Nature's Plus, and it's called GI Natra, GINATRA. And it has got a combination of lots of different things in there for gut healing, including a probiotic. So it's an all-in-one supplement. The other one that I love is by NutriAdvanced, and it's called GastroFlux. And that's another really lovely healing one. And that kind of does all the way through the system. But if it's the stomach, specifically for mastic gum, there's a company called BioNutri. We get great feedback on this product, Patricia, and it's actually mastic gum complex. So there's a few other bits and pieces in there for gut healing as well.
And how long would you have to stay on it?
I would suggest, it depends really on how long you were on painkillers. Normally I just say rule of thumb for gut healing 3 months, but you could stop after 2 months and see how you feel. But if you're still feeling a little bit of acid or a little bit of pain, or if your stool is any way negatively affected, take another month of it. But definitely 3 months should do it, no problem.
It's one of the reasons for anything with an anti-inflammatory, they say to eat with it, don't they, to take food at the same
yeah,
time?
Definitely.
It's very harsh on your stomach.
In actual fact, what I would recommend people to do is, I would recommend people to take slippery elm when they're on those, because that will line the stomach, but it won't affect the way the anti-inflammatory
works.
Absorbed.
Yeah, that's good advice. Okay, Pat in Bantry, question for Anneliese, please. My partner has a condition called Rosacea, which gets worse when the radiators are on all the time. We had great success using Viper cream in the past, but it's now hard to get. Could Anneliese suggest a treatment for Rosacea? That's reddening of the skin, is it?
It is rosacea, I think.
Rosacea.
Yeah. So it's it would be, some people get it just manifests as very, very red, kind of like it almost looks like inflamed capillaries, nearly in a butterfly shape around the cheeks and around the nose. But some people do get spots with it and acne with it, and it can get very, very aggravated and inflamed. Generally, with rosacea, it's coming from the inside, and I would say 9 times out of 10, people who've got rosacea have stomach issues. So I think supporting the gut is, in the long term, is the best way. This person has been very lucky that they managed it with that cream, and that does work for some people. So the ones that have worked here in the shop for people, I'll mention a couple. The first one is Salcura Anti-Ac, and that comes as a wash, and you can also get a spray, and then you can actually get a spot treatment cream as well. So it's really good for rosacea, but it's also fantastic for teenagers or anybody who suffers from acne, and it's all natural. Some people gave us good feedback on a product called Poco, and they have cannabis oil in their serums, so you could try that. The other one that's fantastic as well is a product called Rosacea, and we actually discovered how well this worked, Patricia, when a wife brought her husband in 2 days before her daughter was getting married with a huge breakout of rosacea, and we used a tester sample to do him up with the Rosacea, and it actually covered it up beautifully, so much now that he is a regular customer. But it actually takes the anger out of it, and it covers it up beautifully for you, but it also helps heal at the same time. So you could try one of those 3.
Okay, well done. Hi, Anneliese. Can statins and blood pressure tablets cause anxiety? The reason I ask is, when I take mine, I seem to get restless and jittery just for about a half an hour afterwards. Is there a herbal remedy that could help?
Yeah, possibly, Patricia, there would be. I mean, I wonder, would it be, so if it was the blood pressure medication, if it's a diuretic, does affect the way that your kidneys get rid of things like magnesium and potassium and sodium through the kidneys. So if there was an imbalance in those, that would definitely lead to kind of that restless leg feeling. And then a statin possibly could cause it, but generally that I think the side effects of that could be more long-lasting. So I know this is just me purely speculating here, Patricia. I'd say it's more likely to be the blood pressure medication. So you could try maybe taking a magnesium tablet with it. But I would say if it's only for half an hour, if you can live with it and it goes away, I wouldn't worry about it too much. But if it becomes more prolonged, start with something like magnesium, a low dose, something maybe even like magnesium citrate would be good, and magnesium malate. They're pretty good for restless legs. So, and they come in generally, you wouldn't want to take any more than 100 milligrams if you're taking it in and around the same time as your blood pressure medication.
Okay, hi Anneliese. My daughter has very greasy hair, even after washing it regularly. She's using T-gel shampoo at the moment. Any other suggestions?
That's an interesting one now, Patricia, because some people do just get very greasy hair, but they tend to have kind of greasy, oily skin as well. I would think that possibly the hair follicles are producing too much sebum in a reaction to something. I tend to find that shampoos with sodium lauryl sulfate in there have the worst effect on people if intolerant to sodium lauryl sulfate. So that would give you greasy hair, possibly, but maybe flaky scalp as well, or itchy scalp. Some people even get little spots on their scalp. So I think the first thing I'd recommend is switch over to a natural shampoo with no sodium lauryl sulfate. And I know that a company called Avalon, they do an apple cider vinegar one, which would be lovely for greasy hair. The other thing that she could do is she could just do a rinse with something like apple cider vinegar, and if she doesn't like the smell, you could put in a few drops of essential oil, not a lot, and that might help manage the grease. And if that doesn't work, then I suppose I think you probably need to go for something that has, quite strong, that strips the hair of oils, which would be, I think you probably get products like that in Boots.
Yeah, and I don't know if this is of any help to the listener, because I don't know what age the daughter is, but I remember as a teenager, I used to have very greasy hair, and I kind of grew out of it. Definitely,
and that's very typical with teenagers, because of course it's the whole puberty and the hormone thing. So, but generally, Patricia, you'd probably have maybe a greasy skin and oily skin at the same time. So we don't know if it's the case with this person. It could be a hormonal thing, and maybe just a little bit of hormone balance and liver support could help there as well, especially if there's other kind of symptoms. So there are products, things like monthly support by Nature's Plus and PM support by the Natural Health Practice, are specifically designed to kind of help young people balance hormones, but more if they've got kind of PMT coming up to their period. It might have a knock-on effect on the hair, possibly.
Okay, one final one for Dennis. Can Anneliese suggest any supplement to increase energy? Dennis describes himself as feeling tired a lot, particularly over the past number of weeks. He's taking vitamin B and vitamin C supplement daily, but it doesn't seem to be making a huge amount of difference.
I always think a tonic at this time of the year, Patricia, is great, because I do think that we are starting to get a bit run down, and life is very busy, and your body is fighting a lot of coughs and colds and viruses. So the first go-to I always recommend is the Source of Life Gold, because there is a bit of ginseng in it, so that can give you a great energy boost. I get a great kick from that, and I'd nearly always do a month of it around this time of the year. If it's only a kind of a temporary slump in energy, ginseng is fantastic just to give you an instant energy boost, and it's not the kind of energy jittery that you'd get from caffeine, but it does help keep you kind of awake and motivated and keeps you going. And that's great as well, especially if you've got a very stressful life, because it also helps to support the adrenal glands. So that could be another alternative, is just to get yourself some good quality ginseng. Terra Nova do a beautiful range of products with different ginsengs in there, and my absolute favourite one of them is called Dynamic Synergy. And you don't need to take it every day. You can just take it on the days where you feel a little bit tired.
Okay, listen, have a lovely week, and as always, a pleasure. Thanks for that. That's Anneliese Dressel, Health Hub, Times Square in Ballincollig. As heard on the radio, will go up on her website this afternoon, healthhubstore.com, and John Paul will put it up as a separate podcast wherever you get your podcasts from. So that's where I leave you for today. My thanks to John Paul McNamara for producing. Nick Riches is with you for the afternoon. He's got loads of Christmas songs. Talk to you tomorrow at 10.
Cork Today on C103.
With Corrigan Insurance's Macroom, now part of McCarthy Insurance Group. They don't just talk the talk, they walk the walk. See MIG.ie.